The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and, of course, our technical producer, J.D. DeAngelis. This morning in studio with me is Brad White, a compounding pharmacist. A couple of weeks ago, the focus of our program was on current news in pharmacy. And we had an overwhelming response to that program, so today we're going to continue our conversation about pharmacy, including vaccines, supplements, and our recommendations for what to keep your medicine cabinet this spring, to keep in your medicine cabinet this spring.
All right, I'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from your smartphone app store on your mobile phone. You can take our program with you wherever you go, road trips for the weekend or whatnot. You can look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, you can post up questions on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So our topics today are vaccines.
All right, well, first, I think one of the most questions we get in the pharmacy at the moment is on shingles, and if you haven't had shingles, hopefully you've either known someone who has, or you've seen those terrible radio or TV commercials that have images that are a little horrifying on it. What is shingles? Well, shingles is a painful rash that often happens. It has blisters. It's caused by the varicella virus, which is the same virus that causes the chickenpox. And after you have the chickenpox, that virus stays in your body, and it can be dormant for many, many years. I kind of like to make the analogy that it's one of those conditions that comes up when you have a whole lot of other things going on, whether it be another illness or stress or an emotional event. It kind of, for some reason, wakes up and then causes this outbreak. It can be in a number of different places on your body. It can be on the side of your face. It can be on the trunk of your body. But it's one thing, it has a rash. It can be very painful because it affects your nerves. And the good thing is we have 2 vaccines now that can help battle shingles. Our first vaccine was called Zostavax. It's a one-shot vaccine. It is what they call a live attenuated vaccine. So it's a vaccine that you really only want to get generally by itself. Sometimes you can get it with the flu vaccine also. But it's a vaccine that usually, in the beginning, they thought was a one-time administration, and it would last you for the duration of your life. Well, as they've studied it over and over, they found that you get coverage. It's probably not going to last you 10 years at this point in time. So the new popular vaccine is one that was just approved last November. It's called Shingrix, and it's a recombinant vaccine. So it's not the same as the live vaccine. There'll be a wider population that is eligible to get this particular vaccine. And they're finding right now that in clinical trials, it's more than 90% effective in preventing shingles. It can also reduce the likelihood of peripheral neuropathy. And peripheral neuropathy is the problem from shingles. It is the long-term nerve pain that can hang around after you have the shingles, and that is the really frustrating thing. So if you see a rash on your body and it's uncomfortable, don't try to be a trooper and assume that it's going to be fine and go away in a couple days. I know spring's coming and we're going to have other contact dermatitis issues with maybe poison ivy or poison oak or bee stings, but if you suspect that it could be something like shingles, I encourage you to look at a picture and see what it looks like. The sooner you can get treatment, the better, because the sooner you can get ahead of that, the less risk you'll have for long-term nerve pain. And that's something we want to help you avoid. And getting a Shingrix vaccine or a Zostavax vaccine at the Medicine Center Pharmacy is one of the best ways to get ahead of that. So 50 and older is recommended by the CDC. And the CDC, which is the Centers for Disease Control, they're kind of our healthcare watchdog in the U.S. They recommend, even if you've had the Zostavax shingles vaccine, that you get the Shingrix vaccine.
You know, we've actually heard of individuals in their 30s and 20s getting shingles. What is is there any particular way that we can figure out in those younger folks if they should have that vaccine?
Well, below the recommended age of 50, you're probably going to have to talk to your primary care physician and your insurance company. I do know we had a situation where we had a teacher in one of our pharmacies years ago who, because of his particular health condition, his doctor felt he was at higher risk, and he was below age 50, and between the doctor and the insurance company, they agreed to immunize him. So it's going to be an individual type basis, but you're right. I mean, there are certain conditions that make people more prone to get shingles. Think about patients that have diabetes or heart disease or some type of immune condition. You could be more prone to get it. So it's something to think about, and definitely something to bring up when you see your doctor for your annual visit.
Well, and the treatment for shingles is, in most cases, very expensive and long-lasting. Attacks come and go, as I'm told, and the topical products they use can be very expensive to treat it, and it can affect all parts of the body, like it can literally get in your eyes and every other part of your body. So this is a situation where if you're in the age pattern, you really should get one of these vaccines. So the Shingrix is 2 injections, 2 months apart.
At least 2 months. So they say get it on today and then wait 2 to 6 months. But
correct.
Generally, most of our childhood vaccines are repeat vaccines, so you get them at multiple stages. And I don't want to call it the second dose. I don't want to say it's a booster, but they're finding that it takes 2 doses to get that maximum benefit. So, and that makes sense.
And we've seen some effective rates on the early shingles vaccine of 39%. Am I correct there? Roughly
90% effectiveness of the Shingrix.
Okay.
And they're finding the
Zostavax.
The Zostavax they're finding was like 50-60%, and it's only probably lasting 6 to 8 years, maybe 10. And they feel that the longevity of the Shingrix is going to be much longer and much more effective.
Okay. So what about pneumonia, various types of pneumonia vaccines?
Well, we got a couple pneumonia vaccines now, too. We've got the tried and true Pneumovax 23, which is a polysaccharide vaccine which has 23 different strains of pneumococcal bacteria in it. You can't get pneumonia from getting this vaccine, but it will help protect against these 23 types of bacterial infection. This is another situation where anyone ages 2 through 64 should have the vaccine, and once you turn 65, Medicare guidelines recommend that you have a Pneumovax 23 and a Prevnar 13 vaccine, which we'll talk about here in a second. But pneumonia affects a lot of different areas in the body. It can be infections in the lungs, it can be infections in the blood, the spinal cord. So anyone can get pneumonia. Children under 2 generally don't, but people over 65, it's one of those things that there's 18,000 people a year die from pneumonia. So it's preventable. There's no reason not to get protected with the pneumonia vaccine. Pneumonia vaccines can be a little tricky. Our technology is improving at the pharmacy level because now there's state databases that can help you remember if you were vaccinated. One of the things I would encourage you when you get a vaccine, whether it's at the medicine center or at your doctor, is you have a list of what you've had. Generally the pneumococcal vaccines like Prevnar Pneumovax, you get a vaccine generally every 5 or 10 years, and it's really hard to remember. Flu vaccines are easy. You get a flu vaccine every year. But sometimes it's hard to remember if you've had pneumonia vaccines. So I encourage you to keep a list, and we can try to help you not only keep track in the pharmacy computer, but also with the state database that your doctor reports to.
So what about Tdap?
Tdap has been a really popular vaccine in the pharmacy lately. As far as why get Tdap vaccine, Tdap has 3 different things in it. It has something to protect against tetanus, which is also called lockjaw. It's kind of rare in the U.S. today, but the big thing about it is it can cause tightening in the muscles, so you can't open your mouth or swallow, and that can be a really scary thing. Believe it or not, tetanus can kill 1 out of every 10 people that get it, so you don't want it. Diphtheria, that's the D and Tdap. Diphtheria is also fairly rare in the U.S. today. It can cause breathing problems, heart failure, paralysis, and death. Diphtheria can cause a thick coating to form in the back of the throat, so it's something that's difficult to overcome. But pertussis is the big thing, or whooping cough. Whooping cough can cause severe coughing spells, which can lead to difficulty breathing, vomiting, disturbed sleep. It can lead to weight loss, and 2 in 100 kids and 5 in 100 adults can be hospitalized with pertussis. And guess what? It can lead to pneumonia and other complications, including death. So pertussis is the big thing. We don't want our kids to get pertussis, and many adults haven't had a Tdap vaccine booster in years. So new parents, mothers, fathers, new babies, and their grandparents, physicians are actively recommending these patients get a booster Tdap vaccine. This is something that really you ought to have every 10 years, but it is something that can help make sure you take care of that little one that's new to your family and avoid any healthcare complications that could really be a problem.
Okay, growing up, my mother always told me, and this was a common discussion, that if you stepped on a rusty nail, if you didn't get a tetanus anti-tetanus shot, you're going to get tetanus. So where's this sit?
It still sits that way. Right now, they recommend that every 10 years you get a tetanus booster. And what they've basically been giving is the TDAP, because you get the tetanus, pertussis, and diphtheria vaccine booster. But it's still a risk. And, I was lucky enough to cut myself a couple years ago. I'm sure my wife would be happy to remind everyone before our company Christmas party. And at the Maps Museum, I was disappointed. I missed the tours of the planes. But the first thing they asked was, when's the last tetanus shot you had? Because when you have a severe cut on a piece of metal or something, they want to make sure you've got protection against tetanus.
Okay, first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center Pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on medshoprx.com. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today, Brad and I are talking about pharmacy and vaccinations. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. So, we're talking about vaccines in the first part of the program. How about hepatitis B?
Hepatitis B. Many healthcare workers are probably real familiar with hepatitis B. Hepatitis is a disease of the liver, and it's caused by a virus that's called the hepatitis B virus in this case. It's an infection that's a short-term illness that often lasts. It could be dormant in the first 6 months. Sometimes you never know if you've been exposed. It's one of those things that's a little scary. And you can have a number of symptoms. It can be fever, fatigue, loss of appetite, nausea, vomiting. Jaundice is what they call when you have yellowing of the skin or darkening of the whites of the eyes because your liver isn't working as effectively. You can have pain in muscles, joints, and stomach. And then there's chronic hepatitis V infections that are long-term, and it can be very damaging to your liver to the point where it doesn't work anymore. So chronically infected people can actually spread hepatitis B. It's something that is a communicable disease, and we want to make sure that not only we prevent it, but we control that. Believe it or not, hepatitis is spread in blood, semen, or other bodily fluids. So it can be passed from a mother to a child during childbirth. It can be passed by sharing razors or toothbrushes with infected people, sex with an infected partner, needle sticks, accidental or even if it's regular insulin shots from a patient with diabetes. So about 2,000 people die of hepatitis B every year in the U.S. So it's something it's not a small problem. It's something to take seriously. So generally, it is a vaccine that's given in 3 shots. Usually, it's over a 6-month period. So you get a shot today, a shot in 2 months, and a shot in 6 months, for example. And infants, children, and adolescents all are eligible to get this particular vaccine. The ways you can pass it is who should consider getting it. You can appreciate that all medical professionals are recommended to get it if you're going to have any remote possibility of contact with blood or infected patients to protect yourselves and your family. It's been around for years. I mean, I'm pushing 40s and 45, and I got it in high school before I went into college for my pharmacy career. So it's something that's been around for years. It's a tried and true vaccine. It works very well. I encourage you to talk to your doctor or come into the medicine center and make sure that you are protected if you're going to have any potential to be exposed to blood or things of this nature. You could be a caregiver for a family member, or you could be exposed to it in your job. So all things like that could be possible exposures.
So how about meningitis?
Meningitis has gotten some press lately, given some high-profile cases on college campuses, even here in Ohio. Meningitis is a disease that's caused by a bacteria, and it's an infection in the lining of the brain or the spinal cord. And these infections can happen even when people seem like they're healthy. It's something that can come on just suddenly. And generally there's 12 different types, and the vaccine covers 12 types. There's different serotypes, and we don't need to get fancy there. But the recommendations now are people who are at risk are infants younger than 1 year old, and then adolescents and young adults ages 16 through 23. And they seem to be the most susceptible populations at this point in time. But even when you get a meningitis vaccine, there's still 10 or 15 people out of every 100 in the U.S. who suffer and can run the risk of death. So take it seriously. Talk to your doctor. Generally, before kids march off to college, it's something your doctor is going to talk to you about. The vaccines are available at the medicine center, so we can work with you to see if your insurance will cover those at the pharmacy level. And don't be afraid to ask questions and read up. A lot of the information I'm giving you today about these vaccines is on the CDC website. So if you go to cdc.gov and then you type VIS for Vaccine Information Sheet in their search box, you'll get a nice list of easy-to-read and understand information about what the condition is, what the vaccine is, who should get it, who shouldn't, what the side effects of the vaccine could be. Most of the vaccines we've talked about today, you get a shot, okay? Most of them are in the muscle, in the deltoid of your arm. You could have some redness. You could have some swelling or inflammation. You rarely are going to get the condition from the vaccine. So I have to give everybody a hard time who thinks they get the flu from the flu shot. Guess what? You don't. But you could have an immune response, and that's what's supposed to happen. Your body's immune system is going to build antibodies toward that vaccine, and that's going to help you fight the infection, God forbid you ever get it. So, you could have flu-like symptoms. You could have a little bit of a fever or headache, or you could feel tired or under the weather, but that doesn't mean you got the disease that you just had the injection for. Okay?
So why are we talking about vaccines today as pharmacists? More and more vaccines are being moved into the pharmacy environment. And it is more convenient for physicians as well as patients. So that's why we're making sort of a big deal about it today. So you're listening to Health Matters. It is the bottom of the hour and time for the news.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Spring is in the air, and it's the perfect time to shop Northeast Ohio's largest auto mall with one click at KimThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, something for everyone's price range. And KimThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? It's never a problem. We have a huge selection of pre-owned vehicles to choose from. The Kim Thorne family names one you know and trust that's been committed to our community for over 80 years. Shop KimThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Welcome back to Health Matters. You're listening to From the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about pharmacy supplements and what to stock in your medicine cabinet for spring. We've got a lot more to cover this morning, so let's get back to the show. So we're on to vitamins and supplements.
We are. I think we're going to talk about vitamin D first. Vitamin D. You know, we live in Ohio, so it's kind of hard to get vitamin D production from the sunshine on our skin. Although today's looking promising. Vitamin D is an important vitamin. It's found in dietary sources such as fish and eggs and fortified milk and cod liver oil. The sun contributes significantly to daily production of vitamin D. You know, if you got about 10 or 15 minutes of exposure 4 or 5 days a week, you would get adequate vitamin D production out of your skin. But it's kind of hard, especially in our wintertime months, and, you know, with the fears of skin cancer and things of that nature, you got to be careful with how much sun exposure you get and what type of sun exposure you get. So while exercising caution with sun exposure to recommend not getting sunburned, one of the great ways to overcome any issues with vitamin D deficiency is supplementation. And there's 2 different types of vitamin D. For years and years, doctors prescribed vitamin D2, which was a form of vitamin D that was very easy to measure in your blood. And so that was the dose that they gave. And it worked fairly well, but they're finding now more and more research shows vitamin D3, which is generally what you can buy over the counter, and now many of the prescription forms are turning into, is much better at bringing up your vitamin D levels to where they need to be. And vitamin D is great because it's proven as we age, it drops in our body. Vitamin D is important for a number of different things. It helps in the absorption of calcium in the intestine. It helps to assimilate phosphorus, which is an important essential mineral. As we age, as I mentioned, it drops. Certain medications cause vitamin D deficiencies and can decrease fat absorption. It's also one of those things that has been found to have a lot of potential for your immune system and how well it functions. And we're also finding that vitamin D is one of those things that a lot of people with chronic conditions like diabetes, heart disease, Alzheimer's, many of these patients have low vitamin D levels. So I'm not here to say that low vitamin D causes diabetes, heart disease, and things of that nature, but it looks like patients that are under a lot of stress with different disease conditions or aren't in best of health have low vitamin D levels. So I think it's something that you might find when you talk to your doctor. More adolescent kids are getting put on vitamin D, especially if they spend a lot of time indoors, or they have conditions with like ADHD or different cognitive issues. Newborn, pregnant mothers now, many of their prenatal vitamins have vitamin D and also fish oil in them, and we're going to talk about fish oil in a little while. But vitamin D is an important item. If you'd like to get some more information, please talk to the Medicine Center pharmacist about it. Generally the recommendations run differently for different age groups. So kids are going to be a little different from adults. For most adults, I would say 2,000 to 4,000 units a day is an acceptable dose. But check with your doctor and make sure that you are getting the right amount for your particular condition.
So we're going to talk about coenzyme Q10 next, which is shortened CoQ10.
CoQ10 is a medication that is very good for your heart. One of the big pushes in our healthcare community now is patients that have heart disease and high cholesterol. And high cholesterol is something that can form plaques in your arteries. It can kind of be like a garden hose that gets built up on the inside from calcium deposits and things from your city water, if you will. And when those buildups happen inside your arteries, they get smaller and smaller and smaller, and as a result, your blood pressure goes up, and you could have blockages, which results in a heart attack or a stroke, and you certainly don't want that. So, many doctors now, the standard of care is what they call a statin drug. Statin drug examples are drugs like Lipitor, Zocor, Crestor, or Simvastatin, Atorvastatin, Rosuvastatin. Those medications are designed to do a number of things. They're designed to help reduce that plaque buildup in your arteries, to lower your bad cholesterol, bump up your good cholesterol, and hopefully set you up for a good working circulatory system for your life. One of the bad things about those medications is they can deplete CoQ10. And CoQ10 is a fat-soluble nutrient. It's made in every tissue in the body, and it's something that can be depleted in certain disease states and the certain medications that I mentioned. It's an antioxidant, which means it's really good to help protect against radical damage in your system. And one of the best examples of free radical damage I can give you is sunburn. When you have overexposure to sun and your skin gets red, that is the result of radiation damage to your skin. And that's an analogy to free radical damage. And that can happen on the inside of your body and on the outside of your body. And CoQ10 is an antioxidant, much like vitamin E or vitamin A, that can be helpful to protect against these assaults on your body system. Coenzyme Q10 is an energy-producing molecule. It is made in the mitochondria, and it's one of the essential ways that your body can make ATP, which is energy for your heart muscle. And it's something that's really important to help in the overall production and everyday heartbeat. It can reduce platelet stickiness and can lower your blood pressure, believe it or not. So can you get deficiencies of vitamin or of coenzyme Q10? You can. Like I said, the medications externally can cause a problem. Some disease states can. But supplementation has been studied in a lot of different clinical trials, and there are benefits for patients that have congestive heart failure, also on statin medications, and there's a lot of benefits that are showing up lately that can hopefully help make therapies like statin drugs more tolerable, can help reduce the risk of you having muscle weakness or cramping in your legs. That is often a problem with statin drug therapies, and it can give you a boost of energy, too. So there's a lot of studies out there. I encourage you to ask us at the Medicine Center about CoQ10. It's my opinion, and if you're taking a statin drug, you should definitely be taking 100 to 200 milligrams of CoQ10 a day. But again, check with your healthcare professional. But that's my recommendation for CoQ10.
So, how about the B complex group, which encompasses many of the B vitamins?
B vitamins are a whole family of water-soluble vitamins, which means whatever you consume on a daily basis, if your body doesn't use it, it's going to eliminate it in the urine. Mm-hmm. Conversely, vitamin D and vitamin A, those are fat-soluble vitamins. So if you consume too much, your body's going to store it in your adipose tissue, generally around your belly. So vitamin B is important to get on a daily basis. There are a number of different B vitamins, B1, 2, 6, 12, niacin, folic acid, and these vitamins are all generally best given in what we call a B complex. So a B complex vitamin covers all the B vitamins rather than you singling out one or two. It's more cost effective to get them as a B complex, and again, they're water soluble, so what your body doesn't use, it's going to get rid of at the end of the day. B-complex vitamins are very important for a number of different things in the body, including hormone metabolism. So men and women, as we get older, it's important if you're on any type of hormone therapy that you take a B-complex vitamin to make sure that your hormone therapies can be as effective as they could be. Because if you're B vitamin deficient, your hormones are not going to get metabolized the way that they should. And that could result in a number of different symptoms and problems, ranging from menopausal symptoms like hot flashes and night sweats to difficulty in cognition and memory recall. So B-complex vitamins, while they seem really simple, They have benefits from everything from hormone replacement therapies, and that includes oral contraceptives or birth control pills for childbearing women of childbearing age. Also, blood pressure modulation, energy levels. Many patients may be already familiar with getting a vitamin B12 shot or taking vitamin B12 sublingually under their tongue for energy, and that's okay. So that's a couple examples of B vitamins and how they're used in the body and how they work.
So, how about fish oil?
Fish oil is one of my favorite items. Fish oil is an interesting product because of the way our standard American diet has evolved. We don't get a lot of good omega-3 fatty acids in our diet. Omega-6 fatty acids are a lot of the oils that are used in cooking and food preparation. Omega-3s, our body can't make them. We have to get them from somewhere. And generally the best sources of those are small fish, and some plants like flax oil or flaxseed is an option. The problem with flaxseed is your body has to make a number of conversions to get omega-3s out of flaxseed, when you can just go to the source and get omega-3 fish oil right from the source. So wild-caught foods like salmon and swordfish, those are good examples. Keep in mind, a lot of the foods and fish you buy in the grocery store, like the salmon, is farmed, and it is not high in omega-3 fatty acids. So it's something that you're going to need to think about and shop wisely on. Your best source of omega-3 fatty acids is probably to buy some from the pharmacy, like the Medicine Center, and we can help guide you to a quality product that has been tested and is free of heavy metals and contamination and things of that nature. And, essential fatty acids like omega-3s have a number of functions in the body, and they're important not only for cholesterol and heart regulation, but they also can be important for making sure that you have good integrity for your skin and your hair and your nails. And why don't we pick up the rest of the benefits of omega-3 fatty acids after our last commercial break here.
You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Brad and I are talking about how your Medicine Center pharmacist can be your resource for vaccinations, supplements, and your medicine cabinet supplies. So let's get back to the final segment of the show.
All right, before the break, I was singing fish oil praises, and I wanted to give you just a quick laundry list of diseases that can benefit from essential fatty acid or omega-3 supplementation before we move on to talking about how to stock your medicine cabinet for spring. So, diseases that can benefit from omega-3 fatty acid supplements: heart disease, hyperglycemia, high blood pressure, depression, arthritis, psoriasis, eczema, diabetes, asthma, irritable bowel syndrome, and a number of other neuropathy or neurological conditions. So if you have dry hair or dry skin or dermatitis or rashes or things like that you continually have a problem with relation to your skin or its integrity, don't rule out essential fatty acids, and we can talk about them at the pharmacy if you'd like to learn more.
Okay, what about magnesium?
Magnesium is important in over 300 chemical reactions in the body, and it's something that it's one of my favorite recommendations for people who have difficulty sleeping at night or if you have restless leg or leg cramps. I would encourage you, if you have a situation where you're not sleeping well, before you grab the Tylenol PM, you come talk to us at the pharmacy about magnesium. You can take 200 to 400 milligrams of chelated magnesium or magnesium glycinate an hour before you go to bed, and you're going to sleep a whole lot better than you would if you take a Tylenol PM type product, because it's not going to give you good restful sleep. And the same goes for leg cramps. If you lay down at night and you have leg cramps or Charlie horses that are frequent, don't overlook just a simple magnesium supplement, because even if you're a really good fruit and vegetable eater, our farmers, with all their best tools, don't put a lot of minerals back in the soil. So a lot of people are still deficient in magnesium because it's something that you have to go out of your way to consume, and it's kind of difficult to get.
So for a general multivitamin, we recommend Linus Pauling Super Multivitamins. And the reason we like this product is because it has herbal energizers, vitamins, all the minerals that you need to give you a supplement that is truly complete. Over the years, we've sold, I'm going to say millions of these, but that's not true. We've sold lots of them. And watch on our Facebook feed. We're going to have a special on these shortly, and we'll post it probably later today. So, we're down to our medicine cabinet. How many people do you think really have a medicine cabinet anymore?
Well, I don't know. I know we have a Lazy Susan in our linen closet in our bathroom at home, but one of the things that I find interesting is that we're going to talk about this today, and the first thing that I should do is go home and make sure that I look and we have all these things in our medicine cabinet. Because how many of you have gone to your medicine cabinet or your medicine storage area in the middle of the night looking for a thermometer, Tylenol, any type of product that maybe you need and you find out, oh crap, it's outdated or I don't have it? Well, we want to encourage you to do a quick inventory of your medicine cabinet for the year and be ready for the summer. And I think it's coming. Today's weather shows it's coming. But, allergy season's right around the corner. So it's probably a good idea to have a couple different allergy-type products in your system. You should probably have Benadryl, because whether you have a situation, it could be a bee sting or even an exposure like poison ivy, things like Benadryl can not only help with the rash and redness and itching, but it can also help take the edge off some allergy symptoms that you might have from hay fever or ragweed or things like that as the pollen starts popping. There's also antihistamines like non-sedating antihistamines like Claritin or Zyrtec or Allegra. Those are great for allergy symptoms on a daily basis that don't make you drowsy. So that's something to consider.
Some of the antique items that you might want to have around the house, not exactly antique, but is an ice bag that you actually put ice in, okay, because you always have plenty of ice. And even a heating pad, which are available inexpensively, and so are the ice caps or the ice bags, and come in various sizes, shapes, and whatever. The thing about the disposables is that the chilling effect only lasts a short period of time. So those are some other things you ought to have around the house, up on the shelf or something, and know where they are when you need them. And the Band-Aids and the antibiotic ointments that are now available these days are inexpensive. I think they've finally got a hold of the adhesive situation. I used a Band-Aid a couple nights ago, and I had about 4 pounds of adhesive on it, and I'm still scraping it off. And it was an old box of Band-Aids. So update your healthcare products, your medicine cabinet. So I want to talk about the Mercy Healthcare Health Fair, and we've been Mercy's been a long-time sponsor of our show, and we've been kind of moving the signs around the studio here this morning so you can see the promotion and the dates when the event is. But it is April 21, and PSA tests are also offered along with a basic bank of. I'm going to grab my flyer with a basic bank of panel of tests. Lipid profile, CBC, CMP, and thyroid, and we'll give you over 30 results. There's 3 others that you can take as an option, in A1C, PSA, and vitamin D. So we do these tests in our pharmacies every month and rotate them around through our pharmacies. Mercy comes in and does these for us. So you need to take advantage of this event on Saturday, April 21st, 7 a.m. to 11 a.m. And this is in conjunction with the Canton Rotary Club. We from the Canton Rotary Club will be there making sure you get to the right place. We'll get you signed up and all that sort of thing. So don't miss this event. It's very important for your health care. The tests are inexpensive and very important to your livelihood. So now April is Testicular Cancer Awareness Month, so we want to remember that, okay? And also, in conjunction with the Rotary Club Mercy Health Fair, you can register by calling the Rotary Club at 330-452-2882. So, where are we at in the 2 minutes we have left?
Well, we do have kind of a special Mercy screening on April 24th at the New Philadelphia Medicine Center. We're going to have not only our normal panel of tests that you just kind of outlined with lipid panels and TSH and glucose and total cholesterol and things of that nature, but we're also going to have Nicole Solinsky from Mercy Medical Center. She'll be there. She's a diabetes educator, and she's going to be there from 11 to 1 to talk to patients about their diet and how diabetes can be controlled and managed in their daily lives. You can bring in your EasyMax blood glucose monitor, and we'll check it with Control Solution, make sure it's functioning well. If you don't know about our EasyMax glucose monitor, it is a monitor program that we have at the pharmacy that is very affordable. A box of 50 test strips costs $7.99. And if you haven't heard about it, I encourage you to ask us at the Medicine Center about it.
And new folks we'll give them a meter if they don't have one. So these products are accurate. I use one myself, so please take advantage of that. And guess what? We're out of time. We would like to remind you, listeners, that if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. And we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.